right, we are back on Morning Line. Thanks for joining us. She's cooling off here.
Yes.
And listen, we're getting into a hot topic this morning. As you see, Affordable Care Act enrollments. And the issue here is what you should or shouldn't be doing at this stage in the game, ignoring right now what's happening in Congress.
Right.
Because President, to be Trump has talked about possibly repealing and having a replacement plan. That hasn't happened yet. If it does, we'll deal with it.
Sure.
But in the meantime, you want to forge ahead. Again,
Absolutely.
this is Sharon Barker. She's with us this morning. She's with Get Covered Tennessee, answering your questions about what it is you need to do. So, again, this is not a political show debating whether it should be repealed or not. She's not here to advocate one way or the other. They're nonpartisan, nonprofit.
Right.
They're just here to help you with whatever's on the table.
That's it.
And so do not ignore the deadline on January 31st. Let's take some calls. Folks may have general observations or questions. We'll start off with Joe. Hi, Joe.
Good morning, Nick.
Good morning, Joe.
Thank you for having Ms. Baker on this morning to explain this
Sure.
complicated situation. Can you imagine how complicated this is for the elderly and the uneducated to do not understand all of these things that Ms. Baker has
Oh, it's hard.
very
confusing.
good this morning.
Thank goodness.
One other quick question. This might be a little bit off subject, but I still like to have an answer if she knows or whatever. What is the status of TennCare right now?
So,
Okay, thank you, Joe.
as we know it, TennCare, because a part of the ACA was Medicaid expansion, and TennCare is our Medicaid program. And so as far as we know, we haven't gotten anything that is going to be changing. We're trying to still get Medicaid expansion here so that you won't have to be pregnant, disabled, or caretaker relative of a small child to qualify for
I was going to say,
TennCare.
that's who qualifies, because people may be wondering, where does TennCare square with the Affordable Care Act? I mean, so TennCare only services who now?
So you have to be pregnant, disabled, or parent, caretaker, relative of a child under 18.
Okay.
Those are the categories.
And children are all covered as well.
Those children are covered. I'm sorry, yes, the children are covered. But the thing is, if we had expanded Medicaid, it would cover childless adults that are low income.
I see.
But because we didn't expand Medicaid, you have to fit one of those three categories. So we don't have a Medicaid expansion. So if you are a childless adult that's making less than 100% of the federal poverty level limit, you're in the gap. You don't get TennCare.
Yep.
And so TennCare right now is still the same as it has been. We don't know if there's anything that's going to change with it, along with the repeal or replace. If that happens, what that's going to do to the face of maybe Medicaid expansion, if the legislators here are going to forge through. I think there are some things in the legislature to try to maybe get a 3-star program, some kind of Medicaid expansion, but I don't know where that is as far as the new administration. I don't know if they've put that on hold or if they're going to forge through with that before any kind of repeal or replace. We haven't gotten information on that
And those
yet.
folks within the Medicare gap who are, folks without children, as you just described, the poverty income level is,
so if you're a household of one person, and a lot of young people are one-person household, maybe they're in college, they're making less than $11,770 a year, they don't have any children, they're not disabled, they're not pregnant, they're in the gap.
Meaning they don't get TennCare,
They don't get TennCare.
and they probably don't have the money to afford something for the ADA.
They don't even get the discounts on the ACA. They don't get the discount because they're under the federal poverty level limit. So a lot of your college students that maybe not staying on their parents' insurance till they're 26, maybe their parents didn't have any insurance for them to stay on. So now they don't have any insurance from their parents. They're in college. They're not pregnant. They're not disabled. They don't have any children. They don't make $12,000 a year. They're in the gap. They don't get Medicaid.
So in general, would most of those people just be uninsured?
They would be uninsured, but they won't get the penalty because they're under the federal poverty level limit.
They don't get the penalty, but they're uninsured.
They can go to a federally qualified health clinic, like a United Neighborhood, a Matthew Walker, a Faith Family, something like that. Those are community clinics, that they can go to and probably get care free on a sliding fee scale, something that they could afford.
Within their budget, maybe. Still, it's problematic, but the good news there is the group you're talking about, if it is indeed college students, hopefully are those who aren't dealing with medical problems. A lot of chronic. Yeah, they're pretty healthy. Yeah,
we have a program called Health Assist with Family and Children's Service that we refer people in the gap to.
Gotcha. Good answer. I hope that helps, Joe. Let's go to David. Good morning, David.
Yes,
Hi,
I
Dave.
got a question.
Sure.
I
I'm a pastor, and I just moved from Michigan, and I was doing ministry over there. Over there was the migrant would come from April until September. Now, would they be able to apply for some kind of Medicare, Medicaid stuff if they were qualified for that while they're over here in Tennessee or in Michigan?
Okay, who is it? Is it just somebody you know, or did you say migrant worker? What did you say?
Yeah. What I do migrant ministry. I go to the migrant camps where they work at, and I give them food and all that stuff. But over there in Michigan, they had clinics where you could go and get your medicine and so forth. But here, this is my first year, so I don't know how that system will work here.
Yeah, so you have to be lawfully present in the United States to even qualify for the Affordable Care Act program. So they would possibly benefit if they're not here legally, if they don't have like a green card or you know, some kind of document saying they're here legally. You could go to the clinics here, like I was just talking about, the community clinics. Those are federally qualified health centers. You could call the Health Assist number. That did I give the Health Assist number?
Yeah, it's 1-800-269-4038. And we're going to give these numbers out. Well, there, Mary Elaine already put it up. Great job there. So those are some numbers. And everyone grab your pen and paper because we're going to have those up throughout the show. But go on.
Yeah, so, you know, there's help for them, maybe not on the marketplace, but through qualified health centers or the Health Assist program. And just depending on what their status is, we could help them. So if you wanted to get in touch with us and we could work, you know, one-on-one to see exactly where each person is as far as eligibility goes, because there are a lot more that goes into eligibility, you know, that we could sit down to see if they could fit a program or the ACA, depending on their status.
You know, I was wondering, with the talk that's going on right now with the president-elect and what's happening, if they were to repeal, and again, I'm not asking this politically speaking, but if they were to repeal the Affordable Care Act and not have a replacement, at least initially, how many people would all of a sudden perhaps find themselves without coverage?
Right. So
and we're not advocating. I'm just trying to lay that, because the president himself, or Trump, is saying that he hopes to have a replacement plan in place. But if there wasn't, I'm just curious.
So if they were to repeal immediately, there are over 20 million people that have insurance through the Affordable Care Act. And the thing is, they would lose, you know, their insurance, but not all 20 million have plans on the marketplace. About 70% is Medicaid expansion. And you know, because so many people have insurance through their jobs and through Medicare, which are your elderly. So it's not just this astronomical amount of people that have the Affordable Care Act subsidies, because so many of them are on Medicaid and so many of them are on Medicare, so many of them are covered through their job. So you still, you know, have maybe 30-40% of the people that are getting it through the ACA, but they would lose those subsidies, which would make insurance go back to being unaffordable because you wouldn't get help paying for the insurance. And then all of those preventive benefits that the insurance companies have to provide for free now, those would go back to being charged to you. You'd have to pay for that. And then so it would just be a lot of people that would lose, you know, coverage. Children that are 26 and now they're not on their parents' insurance anymore, so they're thrown into it, and a lot of them may be thrown into the Medicaid gap.
And that I think is what scares some folks. Again, I think I don't even know if that's a partisan issue. I think people may like the idea of repealing the Affordable Care Act. Some of the folks do, but I think most everyone agrees if you didn't like that and you repeal that, and I think President-elect Trump has said as much, there has to be a replacement. And the question is, how quickly can that be in place? And you know, just like when this one started, there were bugs. The new one, you're going to have to be staying up late, boning up on whatever the replacement is. So most, I think, Americans agree, you know, if you do replace it, I mean, if you do get rid of it, there has to be some kind of replacement. Otherwise, it really is a pickle for a lot of folks. Let's take a break on that note. And when we come back, Brian, Robert, Helen, and others, we'll take your calls, plus your friends here. So now you're not going to have to be alone with me. We'll take a break, be back with more talking about your insurance right after this.